Hi, I'm Dr. Anusha GP, Consultant Fertility Specialist at Cloud9 Hospital, Tanisandra, Bangalore. Firstly, what are the indications for an egg donor? Firstly, advanced maternal age, especially more than 40 years of age. Or if she has had previous multiple IVF failures and the cause was especially poor quality oocytes. Or any presence of genetic issues, especially in the woman, which can be passed on to her children. Or a history of chemotherapy or radiotherapy in the past, which caused her egg reserve to deteriorate rapidly. Or if she has had any poor response during the previous IVF cycles. Or history of oophorectomy in the past, that is, her ovaries have been removed surgically due to some gynecological reasons. So how do we choose a donor for the couple? Firstly, we take certain basic requirements that the couple wants, especially with respect to the appearance, like what should be her height, her complexion, the color of her eyes, the hair texture and color. Then we try to match the blood group of the donor to that of the intended woman. In case if the woman has a rare blood group, then we try to match the donor's blood group to that of the husband's blood group or to the blood group that their biological child would be born with. For example, if the recipient woman is AB positive and the husband is O positive, so their biological child would be either A positive or B positive. So in case if we don't get a AB positive donor, we can look for either A positive or B positive donor. And the age of the donor should be between the age of 23 to 35 years of age. So once these basic criteria are filled and when we start screening for the donor, then we go ahead doing the scan for the donor where we basically look for the egg reserve. How is her egg reserve? If the egg reserve looks good, then we take little detailed history of the donor, like asking about her family history, her past history, presence of any significant genetic problem in the family, whether she has a living child of her own. Though the law doesn't tell that the donor should have a living child of her own, but we prefer to take a woman who already has a living child because that determines her fertility potential. And then we run certain blood tests for the donor where we check her general health checkup along with her HIV, HPS-AG screening for beta thalassemia, etc. So once all the blood investigations come normal, then we start the stimulation for the donor and we give her hormonal injections for around 10 to 12 days, just like how we stimulate a woman in a self cycle. So before we proceed with the egg pickup of the donor, there are certain documents that the commissioning couple has to produce to us. Firstly, they have to get an insurance coverage done for the egg donor for a period of 12 months. This is for any complications that arise because of the procedure. And then the intended couple have to sign an affidavit sworn in front of metropolitan magistrate or a judicial magistrate of first class, accepting certain conditions like the child which is born to them of using this donor egg will be their legitimate child and will have all the rights that their legal child would have, their biological child would have. So once we get all these documents, we proceed with the egg retrieval procedure. So not more than 7 oocytes can be retrieved from the donor. This is as per the law. So once the eggs are retrieved, we form the embryos and then the embryo transfer is performed in the recipient woman.